I'm Tanusha and I'll be explaining about the exoskeleton system for skull. For skull, the bones of skull supports the structure of the face and protect the brain. The skull consists of 22 bones which are divided into two categories. There are cranial bones and facial bones. The cranial bones are 8 bones that form the cranial cavity which enclose the brain and serves as an attachment site for the muscles of the head and neck. The 8 cranial bones are frontal bone, 2 parietal bone, 2 temporal bone, occipital bone, sphenical bone, and the inverted bone. Although the bone develops separately in the embryo and fetus, in adult they are tightly fused with connective tissue and adjoining bone do not move. For facial bones, there are 2 nasal bones, 2 maxillae, 2 zygomatic bones, 1 mandible, 2 lacrimal bones, 2 palatine bones, 2 inferior nasal cochlea, and 1 vomer.
Now, let's talk about the vertebral column. The vertebral column is also called the spine or backbone. It's composed of series of bones called vertebrae. The vertebral column encloses and protects the spinal cord. It supports the head and serves as a point of attachment for the ribs, pelvic girdle, and the muscles of the back. The vertebral column has 33 vertebrae and can be classified into 5 main regions, which consist of 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, which also known as sacrum, and also 4 caudal vertebrae, which also can be known as coccyx. The cervical, thoracic, and lumbar vertebrae are movable, while the sacrum and coccyx are not movable and fused. Between the vertebrae are intervertebral discs, which permit various movements of the vertebral column and absorb vertical shock. These intervertebral discs are made of cartilage. A typical vertebra has a centrum and opening called vertebral foramen and processes. The spinal cord goes through the vertebral foramen. A unique feature of the cervical vertebrae is that all cervical vertebrae have transverse foramen through which blood vessels and nerve pass. The first 2 cervical vertebrae have a slightly different shape from the other cervical vertebrae. The first cervical vertebra is the atlas, while the second one is the axis. The thoracic vertebrae have spinous processes that are long and directed downwards. Spinous and transverse processes serve as points of attachment for muscles and ligaments.
Created using Powtoon.